Good afternoon, everyone, and welcome to the Council on Foundation and the Center for Effective Philanthropy's webinar today. Today we will be talking about how foundations are shaping policy during COVID-19.
Yes, so I'm David Cass, the Vice President for Government Affairs and Strategic Communications at the Council on Foundations. I think at this moment, public policy has never been more important. And you can see that at the local level, in the states, and all across the country. And we see the tremendous challenges facing our country. So decisions by policymakers, they matter. How so? Well, you know, the public sector's resources are dramatically larger than total philanthropic resources. When we look at the bill that Capitol Hill passed on COVID in March, it was $2 trillion, trillion with a T. So, and there was a huge amount of work put into the CARES Act by the council, partners, our whole sector, to make sure that nonprofits were eligible for PPP loans, and also to get the $300 universal charitable deduction. So now, will there be another COVID bill? Will the federal government provide hundreds of billions of dollars to state and local governments? You know, those decisions are going to matter. And philanthropy's done an amazing job of stepping up to try to meet the need. And we see so many relief funds established by community foundations. So many foundations have increased their giving. We've seen 750 foundations, more than 750, who've signed the pledge to provide nonprofit partners more flexibility. And we also know that the more foundations that are involved in advocacy and the greater their involvement, the more likely we are to bring about the greater good. And I think this report that we're going to hear about in just 1 minute from CEP is a really important contribution to the field on the importance of policy and advocacy for the philanthropic sector. So let me just introduce the speakers. Naomi Orenstein, who's the Director of Research at the Center for Effective Philanthropy. Sandra Martinez, the Director of Public Policy at the California Wellness Foundation. Dr. David Blumenthal, the President of the Commonwealth Fund. And Tony Richardson, the Executive Director of the Nord Family Foundation, who's going to serve as the moderator. And let me turn it over to Naomi.
Thanks, David. It's great to be here. I am excited to share the high-level findings from this recently released report, which will then inform our discussion with Tony, Sandra, and David. So there's a lot more covered in the full report, including great resources from other organizations and discussion questions for foundation staff and boards to consider. This and all of our research is available for free download on our website at cep.org. So, philanthropic influence in public policy. The nonprofit sector, including foundations, have contributed to many advances in society, and many of these efforts, often led by nonprofit organizations, have been supported by funders engaging in the policy sphere. At the same time, even though critique of philanthropic engagement in policy isn't new, criticisms have intensified in recent years. And in this moment in particular, it's so clear that the problems that we're facing right now, from public health, inequality, institutionalized racism, that these challenges, these problems are structural and they require policy solutions. Yet, for all the conversation and critique about foundations engaging in policy, there's limited sector-wide data about foundation practices. And that's why we wanted to pursue a study on this topic. We're grateful for the funding that we received for this project from these 3 foundations. And in our study, we sought to, building on other efforts, answer these questions. What are foundation leader perspectives on foundation efforts to influence policy in the US? To what extent are foundations trying to influence public policy? How effective do foundation leaders believe their policy efforts are? And what are the challenges that foundations face, as well as the successes that they've experienced? I do want to speak to terminology. When I talk about what it means to influence public policy in the context of this study, what we mean is influencing government priorities. And this can be through grant making, collaborative action, or a funder using its own voice and directly acting. And there's so many activities, of course, that are in the policy toolbox. Things like research, organizing, media outreach, developing relationships with elected officials, narrative change work, etc. I want to touch on methodology. We surveyed and interviewed leaders of private and community foundations across the country. We also surveyed leaders of nonprofit organizations. Response rates are in line with what we typically see, 38% from our foundation leader survey and 34% from our nonprofit survey. I do, though, want to be open and transparent that there's likely some degree of response bias in the data that we collected. We tried to hear from funders that do and don't seek to influence policy, though ultimately most that we surveyed indicate that they do seek to influence policy. Though we did hear from a pretty good sized group of foundations, more than 200 foundation leaders. I also want to note that we saw very few differences by foundation size or geographic area. And similarly, even though community and private foundations are subject to different rules in the policy sphere, we saw very few differences between community and private foundations. And so I'm going to be focused on the overall data. All right, let's dig in. Here are our main 3 findings. Finding 1, most foundation leaders view efforts to influence public policy as an important way to achieve their goals. These efforts aren't new, but have increased in recent years, yet they remain a relatively small component of most foundations' overall work. 2, foundation leaders recognize that they can't achieve their policy goals alone. Most are supporting grantees' work and collaborating with others. 3, most foundations have had mixed success in their policy efforts or are unsure how effective they've been. Foundation leaders also face common challenges in this work, particularly when it comes to building board support. So let's dig into the first key finding. Foundation leaders see a crucial role for philanthropy in influencing public policy. 90% of those we surveyed seek to influence policy, and they describe that policy is one of the many ways in which they can achieve their goals, a high-value way to achieve impact. They describe policy as a way to ensure more effective grant-making, a better context for the work of their grantees, and particularly relevant to the current moment we're in, they describe policy as key for systems change. And the importance of policy engagement comes through in comments that foundation leaders shared with us. Leaders say things like this that you can see here up on the slide. If foundations do not seek to influence public policy that furthers the goals of their grant making, they are undermining their own work. Any foundation that does ignore that or any other policy connection to its grant making interests is either being willfully ignorant or hypocritical. This is one of many representative comments. And so we see that engaging in policy isn't a new practice for most foundations in our study. Most report having been engaging in policy work for a decade or more. Nearly 3/4 of foundation leaders we surveyed, though, have increased their own efforts in the past few years. As you can see here in the chart, these increased efforts are most frequently occurring at the state and at the local level. Yet, and this is certainly something that Sandra and David, I'll be curious to hear your thoughts on, even as funders are increasing their work in the policy sphere, they still describe policy engagement as a relatively small component of their work in terms of dollars, grants, and time. And the role of foundations in influencing policy has been a subject of scrutiny and debate over the past century. These discussions have intensified recently. I'm sure many of you are following these critiques. Journalists and scholars like Anand Giridharadas, Lindsay Magui, and Rob Reich have argued that policy influence by foundations supplants the role of government, is undemocratic, is a misuse of tax privilege dollars, and that such efforts perpetuate inequality while protecting the interests of big givers. And as you can see here in the slide, among those that we interviewed, about 3/4 both see merit in some aspects of this critique, but also disagree with other aspects of this critique. Most commonly saying that these claims paint a distorted one-dimensional picture. And that comes through in these 2 quotes. Foundation leaders say, I don't point the finger at philanthropy, I point the finger at the economic system that has allowed such concentration of wealth. And grant making alone cannot fix the injustices that have been perpetrated through public policy. What we do see is that foundation leaders overwhelmingly see policy influence as a crucial philanthropic tool one that can further their goals. And they describe in interviews how policy is a way to create change. In fact, some see a moral imperative, and that comes through in this comment. The scales of influence in our democracy are not balanced. Our role is to lift up voices that are often ignored. I want to turn now to our second finding, that foundation leaders recognize they can't achieve their policy goals alone. And so the first and primary way in which foundations pursue their policy agenda is through grant making. Almost 3/4 of funders that engage in policy work support the efforts of their grantees. And in comments, they emphasize the importance of doing this work in partnership with grantees, underscoring nonprofit expertise in policy, and as you can see in this quote here, saying that grantees can probably do this work better than you. Just to give a sense here, foundation leaders in our study support a broad range of grantees' policy activities. More than 90% of those we surveyed are supporting grantees' efforts to collaborate, educate the public, convene key constituencies, organize, support research, and engage in media outreach. I mentioned earlier that we surveyed nonprofit leaders through our nationally representative grantee panel for the study. And we asked nonprofit leaders for their suggestions for how funders can better support their policy work. And most frequently, nonprofits ask for their funders to be more willing to fund more of their policy work and to provide grants that have more flexibility, that demonstrate an understanding that policy change is complex and doesn't happen quickly. And I'll let you take in the comments on these slides just to get a sense of how that comes through in nonprofit suggestions. Almost 90% of foundation leaders are part of collaborative efforts to influence policy. In fact, working with others is the top piece of advice that they would share with a funder considering starting to engage in policy work. And in comments, leaders describe the value of collaboration. They explain how it can enhance impact, ensure alignment of efforts, leverage resources, build broad support. And they note that collaboration can also bring about shared learning and better practice. None of us can solve these problems alone, says one foundation leader. I want to turn now to our third and final finding, that most foundations have had mixed success in their policy efforts and face common challenges. So when it comes to assessing their own foundation's policy work, half of those that we interviewed think that overall, they've had pretty mixed success. They emphasize the inherent challenges of policy work and the inevitability of some degree of failure. Some describe the nonlinear, long-term nature of creating sustainable policy change. And a good number emphasize the importance of assessing policy efforts in terms of contribution, not attribution. And that certainly comes through loud and clear in this comment. A foundation leader noting that this work is hard and the lesson is to keep doing it and try harder. Foundation leaders we interviewed haven't experienced negative consequences from their policy engagement. However, they do face some common challenges. And the most frequent challenge they face is building board support for their policy efforts. As you can see here in this chart on the screen, less than half of foundation leaders say that their board is completely supportive of the foundation's efforts to influence policy. Some leaders describe their boards as wary of policy engagement, citing fears of being political, concerns of policy missteps, or a more general risk-averse stance. And that comes through in comments like these that's up on the screen. Our board is afraid of the word advocacy, says one leader. Others reference the challenges of board engagement and education, boards not understanding how policy connects to their ability to achieve their grant-making goals. And further complicating matters, fewer than 1/3 of leaders believe that their boards understand very well what policy-related activities are legally permissible. Here, too, we'll be particularly interested to hear in the experiences and perspectives from Sandra and from David. And so this wraps up the high-level review of the data. In addition, of course, to surfacing current practices and perspectives, I really hope that these findings spur funders to candidly discuss how policy engagement relates to their work. Speaking of which, Tony, over to you.
with a question for Sandra. Given the current moment that we're in, can you share your thoughts on how funders can use policy for broader systems change and raise attention to systemic inequities that may go beyond health policy and COVID-19?
Sure, thank you for the presentation, Naomi, and thank you for putting this together. This is great. I think this current moment is really ripe with opportunities. I think it's a very difficult moment, but it is our opportunity to look at the systemic issues that are they're being laid bare right in front of our eyes. And I think what began as something that appeared to be a very kind of typical disease pattern quickly became clear for folks in the public health field that it was not typical. It was typical. It's what we expect. And it's also just laid bare how the impact on the economic system and all the different systems that we rely upon are being devastated, and how all the efforts that we have put into place are being challenged. However, it's also a moment where I believe lots of people are looking for different types of solutions and different types of answers to address the systemic issues, because it's not enough to just address the fact that millions of people are unemployed right now and now don't have healthcare coverage. And so, what are the systems that we currently have invested in, that we have in place, that actually don't meet the needs of the vast majority of people? So I think it is a moment for responding to what's happening in communities, because we need to, because we can't ignore it, but also think beyond this current moment and think about what could we be doing? Should we be looking, universal basic income is suddenly a hot topic. And I think for many people 6 months ago wouldn't have ever thought that it was something that we would be talking about. So how do you look at those types of issues and identify ways to test it out, so that when we're moving into the next kind of recovery period, how do we rebuild something that's not what we have now? Because what we have now has not been working for the vast majority of people, and has definitely not been working for people of color.
Yeah, well, my good friend Andrew Yang would argue that he also sort of had a platform around universal employment for all. So I want to turn over to David to see if you have some thoughts on this question as well.
Well, thank you, Tony and Sandra, and thanks to the Center for Effective Philanthropy for that great study. The Commonwealth Fund, which is committed to creating a high-performing health system, is very committed also to using policy as a tool to improve the health system, and we view it as an absolutely central way to disseminate and scale our work. And we have spent a very long time trying to figure out how to get good at doing that. That's not to say we have enormous accomplishments, but we spend a lot of time thinking about it. The coronavirus epidemic challenged us first as a public health crisis and as a health system crisis. So we first got engaged in issues related to system preparedness, the capacity of our system to respond to crisis, and also the lessons that would have for the health system going forward, and trying to formulate policy responses related to that. And in that regard, we focused intensely on the stimulus bills that went through the Congress and the health components of those, working with Hill staff on what we thought were the health-related needs that should be incorporated into those bills. We've now, like the rest of we of course identified disparities as a critical issue in that, and we're talking about safety net facilities, their inadequacies, the need to support them throughout this. But now, of course, that has become a much more central area of work. In every grant that we give, whenever it's remotely appropriate, we think about the policy implications and the timing of the results, because policy windows open up unpredictably. but some of them open up predictably as well. A change of administration, the expiration of a piece of legislation, a hearing that is planned. So we identify policy windows and we jump in. With respect to COVID-19 and the disparities issues, we have focused on educating government officials. Our motto is to get people the right information at the right time in the right way and to the right people. We've held about 50 webinars in the last 2 months focused on the media and policy people. We've written about 60 blogs. We've had over 50 interviews by foundation, by fund staff with the press. A lot of it focused on policy and communicating about policy recommendations. So I guess what I would say is that we build and have built a capability to respond to policy opportunities through our staffing decisions, through our relationships with grantees, through our relationships with people in policymaking positions. And I think that's essential if organizations want to be effective in the policy world.
Thank you. And as a follow-up, I think you hit on an excellent point around starting with government officials and then educating and getting the right information in the right people's hands. So if I'm a funder and I'm interested in sort of doing that, what recommendations or starting points? Where do I start? Who do I contact? Where do I go? Can you answer that question, David? And then Sandra, can you also follow up with that as well?
Well, we are fortunate to have on our staff a number of people who have policy experience. So I've been both a Hill staffer and an executive branch official. I have at least 2 other folks on my staff who have been senior policy officials. So we have an instinct and a set of relationships bringing forward. But we also rely on a series of advisors, people who we rely on for advice about when and how issues will be coming up and when to intervene. And we also meet with them frequently. They give us invaluable intelligence. This is not just at the federal level, it's also at the state level. We work with the National Governors Association, the National Council of State Legislatures, the National Association of Medicaid Directors. So we are constantly bringing in information about what is relevant and what messages at what time people are ready to hear. As I'm sure many of your audience know, the same message repeated again and again and again for decades may have no impact. And then, as we're seeing now, a window opens and the same message has impact. And we look for those windows. But we rely on our own instincts, but also advice from people who are experienced in policy to help us find those windows and package the information.
Hi. So a couple of things. We are a statewide health foundation, so we work primarily in California at the state and local and regional level. We do have some obviously interest in what happens at the federal level because of the impact it has on California. So with respect to kind of how we've approached policy, we've really tried to develop relationships much in the way David talked about with key folks who are either working in different policy arenas as well as having relationships with grantees that are working on policy issues. And I think the important piece for us is really developing the long-term relationships so that when opportunities happen and people step into a policy conversation, they're not new to the conversation and they're not new to us. So a concrete example of late around COVID is our governor has been very committed to addressing the issue from multiple points of view, including kind of economics and the actual healthcare systems. And so he established a governor's task force on economic recovery that has a lot of people on it. And there were lots of questions about what they could actually do. But with having lots of folks on it, there's a number of key partners like Angela Glover-Blackwell from PolicyLink and Manuel Pastor from USC who are on that committee and are able to push racial and health equity agenda in that conversation. And so we've been funding them for a period of time. So we have a long view. And so them stepping into that and then realizing they need resources to do the back end work, kind of the back office work, to be on those committees. So then they can come to us and say, this is this opportunity happening and we think it's important, and we're giving real-time recommendations to the governor about what we should be doing to plan for the future. And so I think it's really looking to those opportunities, but not just trying to jump into them. You really have to develop the relationships both with government and with the folks who are engaging in policy and research and advocacy, so that you can actually step in a supportive way when needed and asked.
So I want to go back to the report and just ask you both sort of what were your takeaways from the report, and why do you think it's important for the field? But I'm going to pause there because, you know, I think one of the pieces that really came out in the report for me was around effectiveness and assessment, and this notion of success, and what does that mean from a policy perspective. I know oftentimes if you're a direct sort of service grant maker, you look through sort of your annual grant making cycles, and on the back end of that year you look and say, was this effective or not? Whereas when we're talking about advocacy, organizing, and policy, I think David made up a good point about a window opened up, right? And we've been doing this work for a long time. So can you speak of, as you reflect on the report, can you also situate your thoughts around effectiveness, success, wins, and losses? If that makes sense, David?
Well, I think this is a humbling activity, being involved in policy, and I think some of the testimony in the report speaks to that. It requires patience, persistence, and a lot of faith in the importance of the work. Once in a while, something dramatic happens. So there were provisions of the Affordable Care Act that resulted directly from proposals that the Commonwealth Fund made or funded, and we can see them in law. We have seen our work cited repetitively in amicus briefs, in critical Supreme Court rulings, and that for us is also a sign of success. And if we see our work in regulation, we are delighted with that as well. So we look for these telltale signs. There's also the opportunity to testify at critical points in the processes of legislative processes. And then we share credit with many, many parents. Every success has many parents. We share credit when Medicaid, when we've been working at the state level on Medicaid expansion, and it happens in a state where we've been working. Can we claim that we don't vote in state legislatures, we don't write governor's opinions, but we are there providing information and educating people.
I think one of the key takeaways, and it was in part of the first finding, I found to be really important, was there was some language in there about being opportunistic and patient. And I think we've already spoke to it a little bit, but I think in this moment, it's very clear why it's important to be opportunistic, but it's also equally important. So it's not an either or, it's an and. You have to really look at this as a long-term commitment. And when I say long-term, I don't mean, this cycle of a 2 to 3 year grant. It's, 5 to 10 to 20 year commitment to an issue or a set of issues or an outcome that we think is essential. So I think it's just important to think about the long-term and have the focus be that. And the second piece I will say is that, I think it's hard to evaluate, and I think we want to say, was our investment important? Did it make a difference, et cetera, et cetera. And I think one of the things that we have learned from previous evaluations was, it's as policy changes as important, with the actual changes that we see happen are as important as building the capacity of people to engage in advocacy. I think looking at measurements that aren't just what are the actual policies, how did things change, but the who did the work and what does it take to make that happen are as important.
Absolutely. So I think we have time for one more question, and then we're going to open it up to Q&A from our audience. So with that, I mean, what do you hope funders take away from today's discussion? Sandra, do you want to answer that?
I'm sorry, could you repeat the question?
Yeah, so what do you hope funders take away from today's discussion?
I hope that funders take away, I hope it sparks an interest and something in funders to learn more and to reach out to foundations and others that are engaging in this kind of work and just ask about the how and the why and, you know, kind of the best practices around this. I think learning from others is really important, and so just kind of stepping into it a little bit so that you can kind of move along the line. I think if folks get sparked, I'm happy to talk to folks anytime about what they're interested in doing, and I've reached out to folks at Commonwealth regularly. So I think it's really, there's a universe of folks that you can reach out to. So I think if funders are interested, I hope that they take the step to learn more and see where it takes them within their foundations.
David?
A couple of things. It sounds to me like boards are an issue for a lot of foundations. And I would just say we are 501c3. We are nonpartisan. We rely on a nonpartisan objective. We work with both sides of the aisle. It is possible to be active in the policy world and not violate any of the restrictions on 501c3 organizations. So boards may still not like it, but it is certainly legal and possible to do it. So that'd be point number one. Point number two is it's a lot to expect of yourself to suddenly get policy religion and decide that you want to do it and feel like you ought to be able to jump in and be effective. We have been building and working at policy relevance for decades, and we think about it all the time and we build on it. We have a group of people who are totally dedicated to that work. They work in Washington, but we also have links to state levels. So I think people need to work from the grassroots and build the capability and be patient. And not feel like they have to have big wins within a few months of engaging this kind of work.
Thank you, it's very helpful. So at this time, I'm gonna, again, open it up to Q&A from the audience. And the first question, Sandra, I'm gonna come back to you. Where can funders who don't have the staff with policy expertise get involved? And I think that'll also be a good question for David as well.
I think there's different ways to get involved depending on where you live and the type of foundation you work for. So I think what I would say is looking at kind of any regional associations of grant makers that might exist in your city or county or state, because they oftentimes have a policy committee, or they have sessions that focus on policy. And so I think looking to those kind of regional associations this way, as well as the national, like Council on Foundations and others that host opportunities either for learning or skills building around policy. And those, so you don't have to be coming from a foundation that is engaged in policy, but it's a way to learn about what's happening and how you can engage in a broader way and not in a more specific way.
David, any thoughts on that question? I think you're muted.
Sorry, David, you're muted. We can't hear you. 1 second. Go ahead.
So you were not hearing me?
No, you're muted, yes.
So I would go back and say, if you haven't got a track record and a foundation for the work, you want to find partners who do, and to co-fund work with them where there is an alignment of interest. Working through large organizations or groups that represent foundations may work, but it may also be difficult because your interests may diverge and your strategies may diverge from them. So I would say finding partners who are sophisticated and can carry your issue in partnership with you to the area, to the places in the policy world that are important to reach.
Okay, and as a follow-up, David, there's a question from the audience to you. To what extent do lobbying restrictions on private foundations affect the Commonwealth's ability to communicate with Congress to influence stimulus bills?
Well, there's a lot of things we don't do. We don't advocate, we don't lobby, we don't write legislation, we don't work with campaigns. We consciously try to work across the aisles. We work hard to get people from both parties to our events and to our educational sessions. So making the effort to be nonpartisan is important. And then being very clear on what you can and can't do. We do not comment on legislation directly. We do not write legislation. We don't write regulations. We provide information. Information is our lever, and information is always allowable under your nonprofit philanthropic charter.
Sandra, any thoughts on that question around influencing bills, maybe in your case at the state level? How are you able to do that?
We don't all either. We don't weigh in on legislation. We don't write legislation. We don't. So we follow the same IRS regulations that all private foundations do. But it doesn't mean that we're not watching what's happening. It doesn't mean that we're not, when called upon, educating electeds and other appointed officials about what is happening. But we don't. We stay within the guidelines.
Okay, and go ahead, David.
I want to say something else. If experienced public officials know that information is incredibly powerful at particular points in time. So when a committee has decided to write a bill or a public official is writing a regulation, they are always desperate for relevant information. And education at that point is a powerful intervention. Because it is rare that the information that they need is precisely available. One of the sweetest things we hear sometimes is, oh, I found I needed that information and suddenly you provided it. That's how I think you are influential in a policy sphere as a charity.
Absolutely. Thank you. So I'm going to come back to you, Sandra, with another question from the audience here. Is policy merely code for advocacy with government entities?
No, it's not. It's, when we talk about policy, we talk about a broad variety of activities, many of which are outlined in the report. So whether it's, supporting organizations that are engaging in research to understand pressing issues in the state that will then be used to understand what's happening, that to us is policy. So it's not code. Advocacy for some organizations is the way in which they do the work. But as a foundation, we're not doing that work. We're just supporting more understanding about the issues that we care about and the issues that are central to our mission, which is about the health of the people in the state and the well-being of the people of the state. So, whether it's, education, research, polling, these are all opportunities to get more information about issues that are important to be able to have an impact on outcomes in the long run.
David, any thoughts around that question?
If providing information is advocacy, then much of life is advocacy. And just as an example, we believe that insurance is health insurance is a very powerful public health intervention. The research shows that it saves lives. You can quantify the reduced probability of mortality associated with gaining health insurance. So when governments are trying to find ways to improve the health of their populations, providing that information to them, I think, is very consistent with a philanthropic mission. We are simply pointing out that just like treating heart attacks appropriately saves lives, providing health insurance saves lives. And I don't consider that advocacy. I consider it information, or conveying of information.
Great. And as a follow-up, I know you all talked about sort of partnering and sourcing partners with resources so that they could sort of lead the work in their respective space. When you look at your foundation's goals, how do you partner in a way that is intentional but not sort of overbearing with partners, so that their voice and their work isn't lost in you as a foundation trying to achieve your policy goals?
You mean other foundations or no?
Or some of your grantee partners? If you sort of provide X grant to an organization and they're working in what one may say aligned sort of policy goals or advocacy, how do you do it in a way that allows them to sort of maintain their voice in their work?
Well, we're frankly delighted to have them speak loudly and separately from us. So I don't consider that, I don't see a conflict there. We fund a number of grantees because they are independent voices on issues we care about, and because they're effective in communicating with policymakers on those issues. So we don't care about who does the communicating. We just want to see that it's done and done effectively.
Sandra, any thoughts?
Yeah, I would say that I think it's really important on many of the policy issues that we care about in general, and more specifically at the California Wellness Foundation, is to have the voices of constituents and unheard folks. And so, for us, we believe that those who are most impacted and organizations that are kind of rooted in that really could speak to many of these issues much better than we could. And so we really try to support the work to move forward with their voices and their points of view. And if needed, we will, stand with, and when it makes sense, stand with grantees, and when we're able to. But for the most part, we really try to take the lead and the cues, both from what's happening in the larger environment, as well as kind of what is happening in communities that we care about and we prioritize.
I will say there's one way in which we do limit our partners when they are working with our funding, and that is we do not allow them to advocate for legislation or to involve themselves in politics using our funding. So we fund some groups that we know are good at educating policymakers, but they also have a lobbying agenda. And we make it clear in our grant relationships and in our communication with them that we don't want to be involved in their lobbying. If they violate that, we will not refund them again. So in that sense, we are limiting the voice that they speak with, because it would be a violation of our 501c3 status to fund lobbying by another organization.
Yeah. And as a follow-up to that question, or to that point you just made, what are your thoughts on sort of policy engagement in today's sort of partisan, polarized context? Because that comes up a lot too, right? Like how can foundations and funders be effective when, we have, our legislative elected officials who, in some cases, just can't come, don't see eye to eye on certain issues?
Go ahead, Sandra.
Okay, I think it's important not only to advance our mission, but to kind of defend the progress that's been made. And I think that became clear it's clear right now what we're seeing what's happening in our environment, but we've seen it in different periods. So I think, supporting work that is about a long-term vision is how you engage in the work, and you don't just engage kind of happenstance when things are merged, because then I think you get caught up in all of what's happening in that moment, which may not be towards your long-term goal. And so I think that's why my first point, which is about being focused on opportunities, but having a long vision and supporting efforts that are about a longer vision are really, really important, because then you don't kind of get caught up in the partisan moments that might be emerging.
We constantly make judgments about what lines to cross and when, and our issues that are polarizing can suddenly cease to be polarizing. And we're seeing that right now with the issue of racism. At this point in time, something like Black Lives Matter, which 6 months ago would be seen as a polarizing label, is now, I think, a mainstream concept. And so watching that transition and having a feel for that transition is critical to a nonprofit charity's work, in order to do the things they want to do the things they think are right, but to do them in ways that don't jeopardize their role in civic society. I would say that that is certainly having an ear for those trends and the language that is associated with them is really critical. The other thing is that we make a determined effort to work with people of both parties. We invite them to our gatherings, we reach out to them, we visit with them, we consult with people, experts from both, with antecedents in both parties. We try really hard to understand both sides of the spectrum. Obviously, there are limits to that. There's some things that, some perspectives we don't care to hear about. But when we're talking about different ways of solving the same problem, we're anxious to hear what the two sides or the multiple sides believe is the right approach.
Great. And so we have a statement and a question. And so, Sandra, this is geared or aimed toward you. I'll admit it, I'm very nervous with the word advocacy. How would you recommend I self-educate to get more comfortable with the concept and unlock possibilities?
I will go back to my previous point, which is to try and reach out to organizations that have experience with it to understand kind of what can be done. And then I think looking to resources that exist, we rely and look to Alliance for Justice, which is an organization that does training to nonprofit organizations and foundations about what's permissible and kind of how to operate if you're going to move into it. And so I feel like that's a really important step to understand kind of what the hard and fast lines are, and kind of determine where you and your organization, and more importantly your board, is willing to kind of step into it. And it may be that it's not the right time or the right organization, but knowing kind of the kind of continuum is really, really an important, I think, first step, so that you don't make any missteps if you're going to begin to support advocacy or have conversations about advocacy, so that you're clear about what you're talking about.
David,
you've got to acquire expertise, or whether you acquire it through bringing in external consultants, or whether you acquire it through hiring people who have that expertise, or both. So I think and also I'm sure that there are other partners in the philanthropic world who have more experience, who are available to talk and provide direction, and even to talk with boards to try to get them more comfortable with the idea of working in the policy realm, not advocacy, but working in the policy realm.
And I just add, I mean, I think when I talk to my funder partners and some of our grantee partners about advocacy, I think it's really important that you just get really clear on what it is you're trying to accomplish. Like, get really clear on your goals. Is it to repeal or to introduce new legislation? Is it raising awareness around an issue at your county or local community? So just getting real clear on your goals, and I think that helps you better understand or appreciate the ecosystem or the continuum in which that happens. And so with that, I know we're running short on time here. I want to sort of allow you to have some closing remarks. So Sandra, I'll come back to you, and maybe you can have a closing remark or two.
Well, I'm really glad that this conversation is happening. I think we couldn't be in a more opportune moment to talk about the opportunity and that we're living in, and what is possible if foundations decide to kind of dip their toes further into supporting policy, however they can and will. And the one thing I wanted to say about the last conversation, and I don't know where this person asked the question from, but there are different, it's important to know the kind of foundation you work for. So we work for a private foundation. If you're part of a community foundation, you have there's different regulations. So that's the other thing, to understand kind of what constraints and you may or may not have where you sit. So I'm just looking forward to, what I really hope is that this report, together with the current situation around COVID, as well as what we're seeing around race, racism, and violence, I really hope this is an opportunity for people to talk about how can we look towards a future that is different than the one that we're living in now, and how can policy and policy change be part of that long-term vision. So I really hope that people walk away with a renewed sense of why it's important, and a commitment to try and figure out what they can do.
So I would just offer one caution on language. I am not talking about advocacy. We do not advocate. Advocacy is not within our legal authority or legal permission. We educate on issues of policy. That requires expertise. It requires an understanding of the policy process. It requires nimbleness, but it is a skill. And if you constantly hear the word advocacy when you talk about policy, it will be very hard for you to engage in this work. But if you are clear-eyed and sophisticated about it, you will see that there's ample room for you to scale your work, disseminate, be effective on the issues you care about by informing people who have to make decisions on the issues you care about.
Thank you. And I think we may have time for one more question, and it's a really good question, if you don't mind me squeezing this in. Are you okay on time? Okay. This question again comes from the audience. Given what we saw with the election challenges this week, do funders interested in policy and advocacy have an obligation to support broader democracy versus their own individual issues? How would you advise funders to do that?
I'm not sure I understand the question.
Okay. So I think it's this notion of how do we support sort of a democracy building, like looking at elections, looking at sort of the integrity of our democratic system versus your own individual foundation goals. Does that make sense?
Yeah. Well, no foundation can do everything. And I think if you want to be effective, it's good to focus. And if you and your board decide that you want to change focus because of a national emergency or a national crisis onto a different area of work, which is building effective political systems, that is certainly a worthy thing to do, but it's a non-trivial activity. It requires expertise and relevant skill. And at the Commonwealth Fund, we think that the crisis in healthcare persists, even though we have other crises on our mind. And so we don't feel like we have to stop everything and do something different.
And I think for our foundation, we have a approach that focuses on, the social determinants of health, which now many more people understand what that means. And so we think that where you live, work, play, and access healthcare impacts your health. And we believe that engagement and social connection is vital to good health. And so we have supported community engagement efforts throughout the state as an important part of people being healthy and having healthy lives. And that includes organizations that, talk about the issues that folks are facing. And we have supported integrated voter engagement efforts. And those are efforts that really are about engaging people all the time. So it's not necessarily about a specific election. It's about, we're going to engage folks on the fact that there's no park in their community and how can they work together to get a park in their community. And so we believe that engagement beginning where people are is important and is a way for people to improve their health and wellness. And so we do think that there's opportunities if a foundation wants to, but I don't think it makes sense to just say, oh, there's a crisis in democracy and we have to jump in right this minute. I think it has to be in alignment with the work that you're doing. And if you're a health foundation, if you have if this is the way in which you want to approach the work, then you can approach it this way. But it really kind of depends on the mission of your own foundation and the long-term goals that you have for the grant making and, frankly, the appetite of your board as well.
Thank you. And so with that, we're going to wrap up today. And I just want to thank both of you. Very, very smart, intelligent, and subject matter experts. So I'm sure our attendees really appreciated having you all. I also want to thank CEP for this timely report and sort of bringing in partnership with the Council on Foundations this webinar together, as well as the project funders. So with that, we're going to end the webinar, and I want to thank you all again for taking time today. Enjoy the rest of your week.
Thank you.